Welcome to Health Talk. Today we have with us Dr. Chase Lay, a facial plastic surgeon, and we're going to talk about eyelid surgery. We also have with us, helping me interview, is Evelyn Ross, Masters of Public Health from Iowa. She's visiting, and we're just going to pepper Dr. Chase Lay with questions about what's new about eyelid surgery.
Okay.
Now, I hear there's 200,000 being done a year, and it is one of the most popular types of plastic surgery that women and men want.
Mm-hmm.
So why do you think it's so popular?
Well, it's pretty easily done. I mean, you still need a skilled, experienced surgeon to do it, but the sort of the scale of the surgery, the amount of actual cutting and tissue being manipulated and removed is small compared to, say, a facelift or a nose job or something like that, or a tummy tuck, you know. And people can recover from it usually from within about a week, sometimes a little bit more, sometimes a little bit less. And in some cases, it can really rejuvenate the face without much risk. So it's very popular compared to other cosmetic procedures. It's fairly affordable, and it can be done under local anesthesia. There's really no need to go to sleep for eyelid surgery, in particular upper eyelid surgery.
Now, sometimes people have upper eyelid surgery very young, like the starlets in Hollywood at age 25 and age 27, and then sometimes people have at different stages in their life. So for ladies, tell us a little bit about the stages of life that they would come see you.
Well, for younger people, say 25, 30 years old and younger, occasionally it's a person who just genetically has a little bit of a heavy brow or heavy eyelid skin, and they are just taking a minimum of skin out just to make it easier, say, to utilize makeup, like somebody who is in TV or who is in a public light. Little things like that can be problematic for them or even their makeup team. So I do have patients who are basically public personalities, whether it be through TV or sports or acting, and they will make small modifications like that even at young ages to take a little skin out. In the case of Asian patients, I do a lot of Asian eyelid surgery. They're changing the look of their crease. They're not trying to look Western. They're not trying to look like a different person. They're just trying to make their crease a little bit higher, give it a little bit different shape, make their eyes look a little bit brighter. And sometimes it's actually just for the same reasons, wanting to be able to utilize makeup or in a certain way or look a certain way on camera. And so younger patients, that's why. Older patients, it's typically just to restore the way they looked when they were in their 20s or 30s or even their 40s. They just want to get some of that excess skin out. And in some cases, people just start to have very heavy lids by the end of the day. They feel like it affects their ability to read, their peripheral vision, so you remove that excess skin. And all of that's upper eyelid surgery. Lower eyelid surgery, I've had patients who are very young who want to address the bags under their eyes. And in some cases, you can help them without surgery. You can actually just put fat or filler right under those eye bags, and you can camouflage that. Because it's not so much that the bags themselves are big, it's just that their bony anatomy is kind of deep, and it allows that bag to sit forward, or they're losing fat and soft tissue volume in this anterior triangle here. So if you replace that volume with filler or fat transfer, then you don't have to do lower eyelid surgery. So in those younger patients, a lot of times a non-surgical approach is what's taken. In older patients, you need to address loose skin, remove that surgically, sometimes tighten the lid to maintain function when they blink and make sure their tears drain appropriately, and then reduce or remove lower eyelid bags if they're just too big to camouflage with filler.
Now, for men, when they come to you for eyelid surgery, what do they want, and what ages? Do they come same age or different ages than women?
Men typically are coming in they don't really come in their 20s unless it's for asymmetry. So I do have some my Asian patients who come in for asymmetry or a crease that's not visible. They will come in at very young ages, either before they start college or after they're finished with college and before they move on in their professional careers. But older men usually are coming in just for excess skin and they want that removed or reduced, but not to the same degree that women get it. If you remove too much skin in a man's upper eyelids, you tend to kind of feminize the face or make them look a little surprised. And additionally, a big change like that in somebody who's in their 40s and 50s is very noticeable to their peers at work or their friends or their family, and usually that's something that they're not interested in. So those patients will come in and the first thing they say to me is, Dr. Lay, I want you to make me look better, get rid of this excess skin, but don't make me look any different. And so you have to find out a way to improve their appearance, improve their function, but still maintain a very natural look for them. So, yeah.
So the men who come in, they're usually 40, 50, or 60? Well,
generally, yeah.
And more of them come in their 40s or 60s?
It would probably be more 40s and 50s to start out with.
Oh, because they're trying to maintain their kind of cutting edge in work in a younger, changing demographic in the workplace.
Right. So where I grew up in Texas and where I trained in Illinois, it was a little bit different. People would wait until they're 40 or 50, 60. Sometimes they would just do it for retirement. They'd come in, get their eyes done just because they wanted to enjoy a better look and eyes that weren't so heavy now that they're going on with this new stage in their life. Here in the Valley, where it's very competitive, it's very busy, people want to maintain as youthful or as strong a look as possible. So men come in and they're even in their 30s, but definitely in their 40s and 50s.
So it's like just skin that you're taking off most of the time, or like what happens like with the muscles?
Generally, you're taking out just skin. So let's say a non-Asian person is coming in to improve the appearance of their upper eyelids or their lower eyelids, and it's pretty much a skin-only removal. There are other layers of anatomy. There's a muscular layer and then a layer called the septum, and you may trim those or tighten those. Okay. But for the most part, it's just skin removal, and that usually translates into a less risky surgery, a faster healing process. For Asian patients, if they don't have a crease and I have to create a crease for them, then I'm doing a surgery that goes from a skin layer through a muscular layer through the septum all the way down to a tendon attached to a muscle that opens your eyelids. So you and I have an attachment between the undersurface of our skin and that tendon that creates these high, deep creases that we have. So in Dr. Wu's case, she has a crease on both sides, but her attachment between the skin and the septum and that tendon is a little bit lower, and that's pretty much a common or constant difference in the anatomy between Asian and non-Asian eyelids. Okay. And from Asian to Asian person, the anatomy is completely different. So every Asian eyelid surgery I do is customized to that patient.
Interesting.
Now there's also eyelid surgery for newborn, like congenital ptosis. You know, little babies born where they have no levator function. That's the muscle that lifts the eyelid. And the problem for them, my being an ophthalmologist, is that if one eye is shut closed, they have no vision unless we fix them soon. And so do you do that too?
Oh yeah, absolutely. And in cases that are severe, and if it's going to affect this child's development, never mind school, learning to read, that sort of thing. I mean, you can actually have permanently impaired quality of vision as life goes on if you don't raise that lid and perform that ptosis surgery. And in an infant or a very young child where they have a congenital ptosis that's pretty severe and they have very little muscular function, if any, to lift that lid, sometimes it's not as easy as making an incision, opening the lid, shortening the tendon, trying to reattach that muscle. You literally have to create a sling that goes from the eyelid crease up to the forehead, called a frontalis sling, and they will raise their forehead to raise their eyelid. And you will never have perfect function of that eyelid, or perfectly normal function. It may look very symmetric, it may look very good when you're looking at that child face on, but when they look down, that lid will lag a little bit. When they look up, it may not rise as much as the normal lid, but as long as they can see, as long as they can function better, then you've done them a great service. But yeah, you have to intervene at a fairly young age in a lot of people.
Those are very complicated surgeries because sometimes they need repeated surgery to augment as they grow up, these children, and they're born congenitally with an abnormal levator, so that the fascial layer that connects is just abnormal.
Yeah.
So that's why it's a challenge for ear, nose, and throat surgeons, ophthalmologists, plastic surgeons, and they have to see them sometimes repeatedly until their face matures.
Right. I have a patient right now who lives in Uzbekistan, and her father contacted me because, genetically, anatomically, she's Asian, even though she's Uzbek, she's Russian. And they came all the way over from Uzbekistan. She had her first stage when she was 5, improved her function, but really didn't have a crease. And as time went on, she was 10 or 11 years old. She recently had to return for a repeat procedure. But every time I, go back in there, the surgery is a little bit tougher than it was before. And in a lot of these cases, you go in, as you said, the tendon that's supposed to be attached to that levator muscle is just almost non-existent. You can't see it, you can't find it, it's just not there. And so you do have to repeat these surgeries, revise them as they get older, as they get bigger. And I'll probably end up doing a frontalis sling on her in a few years whenever I can get them back over here from Uzbekistan.
So do you see, are there usually complications for this, or is it usually pretty straightforward?
None of it's straightforward because every ptosis repair is different, and you can do ptosis surgery for different patients, different ages. But the revision rate for ptosis is much higher than it would be for just, say, standard upper eyelid surgery for cosmetic purposes. And ptosis can be very challenging. You can have somebody that looks absolutely perfect the first 2 to 4 weeks after the surgery, and all of a sudden that tendon just gives out, or the scar tissue forms or contracts in a way you're not expecting. And they look overcorrected or they're undercorrected, and you may have to make revisions to it. So revision rates in ptosis surgery, just all comers, can be anywhere from 10 to 15%. And that's not always well described by surgeons who perform ptosis surgery, because nobody wants to tell a patient that you got a 1 in 5 shot of me having to operate on you again, but that is the reality in some cases. Now, in patients who are in their 30s, 40s, and 50s, and they're starting to develop ptosis for whatever reason, the revision rate is lower, or the success rate, if you want to refer to that in that way, is higher. So yeah, it just depends. It's the younger they are, the worse the condition, the higher the revision rate.
Now, you were telling me before we got into the studio that you do a lot of Asian blepharoplasties, which is Asian eyelid surgery, and you have some before and after photos. And most commonly, being Asian myself, we all know that some of us are born with a crease and without a crease. And that crease is called the epicanthic fold. And so I'm sure among the Asian patients who see you, this crease is different. As you said, that it's a procedure that's tailored to everybody. So show us some of your examples.
Oh, okay, sure. So yeah, like you said, in many cases, patients, they have creases, so I don't have to create a crease for them. But like, for instance, this would be the first slide in this reel. This young woman, she really, obviously she's very attractive, has a lot of nice features, but she wanted a crease that was visible, and she wanted her eyes to be bigger. You see those there. And this is a surgery that I did under local anesthesia, and I just created an all-new crease. Now on her, this crease is kind of deep. And I'll explain the difference to that of what deep and not deep and high and not high means in a moment. But in her case, that looks perfectly natural because she has a strong brow bone, a nose, and cheekbone that actually is more, the craniofacial structure, the bone structure is more Caucasian. So this crease fits well on her face. And I really couldn't make this crease much higher than it is because she has some anatomical limitations. And that's just a shot of her from the side. And then, in some patients, they don't want a change that it's too big. Here we have a very heavy fold, and he has an epicanthal fold on the inside that I did not change. And one of the things that he noticed after his surgery, in addition to just looking a little bit different and his eyes being a bit brighter, was that he was a more effective rebounder when playing basketball, because he literally did not have to tip his head back as far to see up. When his upward gaze went up without moving his head, he'd see the ball earlier, and he didn't have to tilt his head back as far. This patient, I actually really liked her eyes before, but she wanted a low, natural-looking crease. And this surgery was done under local, and she healed really, really rapidly. But in her case, she had no crease at all, so I wasn't just removing skin. I literally had to reconstruct the eyelid to create a crease and get the undersurface of that skin to essentially scar down to the levator tendon. And then sometimes, we talked about just age-related changes. This patient here just needed a small amount of skin removed, just to have the crease look just a little higher so she could wear eyeliner just a bit easier, and it didn't look so heavy laterally. So, and these are all done with patients awake. You asked about men. This is a gentleman here who's got just some heavy skin and hooding on the outside, and he didn't want to look any different, but he didn't want to look tired either. So when you look at this photograph, he very clearly still looks like himself, but he doesn't have that excess skin, and nobody at work can really tell that anything happened.
He didn't do anything underneath his eyes?
No, he didn't.
Okay.
No. And in this photograph here, this depicts that intersection that I described between the levator tendon, the septum, and the skin, where the crease occurs. So you can see here, there's an eye here, eyelash line, skin layer, muscular layer called the orbicularis, the tendon attached to the levator muscle that raises this up, and where that all intersects with the septum is where that crease occurs. And in this anatomical depiction, this is more like a Caucasian eye, so you and I internally would look more like this.
Okay.
So in an Asian person's case, this clear septum would actually be a bit lower on the eye, and that's what gives patients that full upper eyelid look. And the healing process sometimes can be pretty dramatic. Sometimes it's almost like, you didn't touch them, they heal very rapidly. Later on we'll maybe have an opportunity to show a series of slides of people healing, but you can see this girl 5 days after surgery,
That's 5 days.
A little bit red and puffy, and then she's gonna look just fine in just a couple of days when I take those stitches out. So
wow.
So we do quite a bit of surgery.
You have to tilt it forward a little bit.
I see. And this is one, just a patient, just aged a bit, just wanted a little bit of excess skin out, and still wanted a low natural crease.
What about Caucasian ladies who are in their 60s and 70s? Do you have those?
Oh, sure.
That's like when their eyelids droop to a point where they can't see very well.
Yeah.
They do.
And they do it right before retirement.
They do. And I, one good example that I have here, this is actually a man.
Oh, tilt it a little forward.
Oh, wow. Yeah,
so
that would really interfere with being able to see.
So this gentleman literally had difficulty seeing. And whether it be a male or a female patient, as you get into your 60s and 70s, some patients just genetically, anatomically will have a lot of heavy excess skin. So you just simply remove that, and that improves their superior and peripheral vision. And actually, when I'm looking at my older patients coming in for functional issues, just for whatever reason, I don't know if it's skin thickness or brow heaviness, men more often are the ones who need surgery for visual field loss than women, just in general, not by a large margin, but just a slight majority. And then some people, this young woman, she's not even 40 yet, but she's starting to get a little bit of excess skin on the outside of her eyes that's showing some hooding. And she just got that little bit of skin removed and just looks a little bit brighter. And
She needs her lower lids done as well.
Well, she asked.
Didn't want.
She asked about that, but she wanted to wait. She later
Yeah.
on just decided to do some filler down there.
Oh, okay.
Yeah.
Now, having this surgery, let's say you go in and have the surgery Monday,
Okay.
and you have it under local anesthesia, and then what do you expect when you go home?
Okay. So the healing process is fairly predictable most of the time. Patients usually go home the day of, the next day, and they're thinking to themselves, oh, it's not bad. I feel pretty good. I'm not really in any pain. I'm not that swollen. I'm not too bruised. Day 3 or 4 rolls around, and that's actually when most of your swelling shows up. And you don't look completely puffy. You can still open your eyes. You can still function. Many of my patients here in the Valley, in the tech industry and so forth, will just work from home remotely. They never really stop working. But you just have to ice regularly every half hour or hour for the first 2 to 3 days. That helps a lot with swelling. You have to just gently clean the incision and then replace ointment, antibiotic ointment or Vaseline. It's not the antibiotic component that's important. It's actually the occlusion and the moisture. It helps the epithelial cells or the surface of the skin heal together faster. And occasionally some patients have some itching. You just use ice packs or Benadryl. There's really not much in the way of bleeding after surgery and that sort of thing.
So then, let's say 1 week post-op, is that when you take out the sutures?
Right. So the sutures come out about post-op day 7. Yeah.
Painful at the office or no pain?
It's actually stings a little bit sometimes getting the sutures out.
And
I
then
use really small scissors though.
And then after that, they probably are not ready for prime time for another week.
Generally speaking. Now, I have had some patients who have worked in the film industry, and I do not know what this makeup is, and I wish I knew because I'd have all the patients use it, but they actually have used an air gun to spray on makeup, and they'll put it over their sutures and go out, and no one can see it. But in general, if you're a very private person, you probably want to give yourself a good 10 to 14 days before you go back and you're out amongst your peers. Because especially in patients with a lot of excess skin, the incision is going to be extended out here laterally, and it's going to be visible for a period of time. It could be visible for 2 weeks. It could be visible for 2 to 4 months. It's very hard to see as time passes, and in some cases you need to camouflage that with some makeup.
And when do they start putting on makeup? After the 2nd week?
No, you can put makeup on within a few days of removing the sutures, keeping in mind that putting on the makeup still may be a little uneven, it's a little bumpy, but it's okay to put makeup on at that point.
Then it's hard for them to take off the makeup.
That's right.
Because you have to be very gentle.
Right. So if anything, you put on just a very small amount of foundation or eyeshadow out laterally where the incisions are a little bit visible and leave the rest of the eye alone, just making it easier to clean.
And then so, are they asked to stay out of the sun? What do you tell them?
Staying out of the sun, it matters some. It's actually, I have had some patients, for whatever reason, they get eyelid surgery, and then the day after they have their sutures out, they go to Cabo. I don't know why everybody goes to Cabo after surgery, but they're laying out and they're tanning, and so you can get hyperpigmentation of an incision line.
Right.
And so I tell patients to stay out of the sun, wear sunglasses for at least 2 to 3 weeks. But for the most part, when our eyes are open, that incision line is actually shielded from the sun. So if you're going about your daily activities and wearing sunglasses or even just a hat, then you should be fine. But in the early phases, first couple weeks, you definitely want to try and not expose those incisions to sunlight.
So do people seasonally get this done? Like they do it summer vacation where they can hide? Christmas recess when they can hide? Is that
They do, yeah. It depends. So my college students will do it Thanksgiving, Christmas. I have a large contingency of patients who don't really celebrate the holidays in December, and December is packed for me. A lot of companies are on shutdown for 1 to 2 weeks, and like if you wanted to have surgery with me over the next couple weeks, and we're in the month of August and September, probably not a problem getting you worked in for eyelid surgery. Right now, December is almost completely booked.
Wow.
So November, December is a very busy time. End of spring is a very busy time. January can be a very busy time. Yeah.
And then, when is like sort of the crunch for the men? The same?
Pretty much the same.
Okay.
Yeah.
Do you have? Is there like you know how if you do one member of the family, they love the results so much, they bring in everybody else they know of?
Yeah, I've done couples on the same day. I did a couple that was going to get married in a year. They did work together on the same day. A lot of times I'll have patients who will show up for eyelid surgery and they'll actually just tell me that they're the first to come and the rest of their friends or family are too nervous to do it. And if it goes well, everybody will show up. And I don't pay too much attention to that, but a lot of times they actually show up. I've had groups of family members of up to 4 to 5 people at one time in my consult rooms, and just one after the other trying to evaluate everybody and get everybody arranged for surgery. So yeah, that actually happens quite a bit.
Now, there's also something, let's say for people who did not want to do their lower lids, like you showed us one, and now there's filler. Some people use their own fat to be filled, as filler.
Oh yeah.
Tell us about that. That's like new the last few years.
Yeah, so fat transfer, we've been using it for probably, 10 plus years. Well, actually longer than that, but with a lot of frequency and just different providers using it. It's been very popular over the last, say, 5-10 years. And it's done under local. You basically undergo a small liposuction procedure. The best fat comes from your abdomen. And I actually have a machine that's automated, and it is self-contained, hermetically sealed, and it preps the fat, because you don't just take fat out and just kind of wash it and inject it into somebody's face. I will prepare my fat and mix it with PRP, platelet-rich plasma, or your own blood that's been purified, because that helps the fat take. But there's a lot of people who thought they were going to get lower eyelid surgery or a mid-facelift or a facelift. I did fat transfer on them, and they just never wanted to do anything else. They just really liked the results.
Really?
You can't just inject big mounds of fat into people and expect it to take, though. You actually have to put it in small amounts all over the face in order to make sure that the percent take is as high as it possibly can be. And not every office and not every doctor has the same percent take. It depends on their experience, how they apply it, how they prepare the fat, and how they harvest it. If you just willy-nilly suck it out with a cannula and you damage a lot of the fat, and then you just wash it with saline and then try and inject it in, it's not going to survive very well.
Well, we're ending towards the 1 minute part of our show. So what is the take-home message that you want all of us to remember after hanging out with us on air? What is it?
I don't know.
If you have eyelid questions, we can call you up, or any facial plastic surgeon.
Oh yeah, sure.
And don't believe everything you read in the newspaper, because everybody is their own person and every case is different.
Every case is unique.
Right.
Yeah.
You just can't say, I want her eyelids, and just glue them onto yourself.
Very rarely is that the case, and I get that a lot.
Right.
I get a lot of patients who come in with pictures of various Korean pop stars and that sort of thing, and I tell them, that person's wearing makeup and they're photoshopped, and they don't believe me. But yeah, just
And every anatomy has to be tailored to the person's surrounding anatomy, whether they have a high brow, high cheekbones, do they have larger nose structures, because you just can't have, unusually different eyelids.
Right. You basically look for a surgeon who can provide you with safe results, natural results, realistic results, and repeatable results. And if that surgeon doesn't have a lot of photo evidence of what they do, they probably don't do it that much.
So thank everybody for coming and joining us on Health Talk. Thank you, Dr. Chase-Lay, for hanging out with us. And if you like the show, call up KSAR and donate to KSAR. And if you like Dr. Chase-Lay, his phone number is at the bottom of our end of our screen. And join us again on Health Talk. Thank you.